So we are here today with Wilma Howe at the Lung Center, and she's graciously enough admitted to give us a little interview to maybe tell us a little bit of her story and how she's done. She's a lung cancer patient that we've been treating for a while here. Thanks so much, Wilma.
Thank you.
Maybe since you were just relating to me how Dr. Kazi had found this spot on your lung last year?
Well, I was due for a checkup for my pacemaker.
Sure.
And then he sent me over to Dr. Harlan, who was a
Pulmonologist, yes.
And he did a scan and found this little tumor in my upper right lung. And he asked him to get me in just as fast as he could, which was 2 days. And then he sent me to you, and you had a nice interview and visit with my son-in-law, who is a pharmacist.
Right.
And he said, Wilma, what are you waiting for? For it to grow? I said, no, and he said, you go in and have this done. And then I talked to Dr. Kazi again, and he said, Wilma, go and have this done. He said, that doctor knows what he's doing.
So you had this spot in your right upper lung, and we were able to get at it with this superdimensional bronchoscopy.
Yes.
And we proved that it was a cancer.
Yes.
And we left the gold seeds in, and
Right.
then you went for your Cyberknife treatments.
Right.
And you drove to those yourself?
I drove to those myself. I slept through some of them. It was absolutely wonderful.
And you're still working full time.
I'm still
Tell us
working
what you
full-time.
do, because it's a great.
I'm a beautician, and I have my shop in my home at Rochester. And I'm working Tuesdays through Saturdays. I take a little time out, during the day. I take breaks. But I just love my profession, so.
And I know a lot of ladies don't like to answer this question, but would you mind giving us some idea of your age? Because
I am 88.
awesome.
I will be 89 in January.
Well, you're a very, very lovely lady, and you certainly
you.
don't look that. And in fact, after this follow-up, because here we are now, it was in February that we treated you?
Yes, February 1st.
So we're pretty far out, and your CAT scans look very
Yes.
good. What you have something scheduled right after this appointment, don't you? What do you?
I have a lady waiting for me for a perm as soon as I get home today.
Excellent, excellent. Well, that's great.
That's right.
We're so happy that you came to us and that things are going very well. And
I have even books in my beauty shop that people look over on the things that I
the
take them
superdimensional
over.
bronch and the
Right,
Cyberknife.
right.
Well, that's great. Well, thanks for being a spokesperson for us. Excellent. All right. We'll see you soon.
Okay.
Bye.